let's get started. Now, if you live in and around in Sawam in the eastern region and you're confronted with a health emergency, you may have to pay extra for ambulance service. Now, for most people in rural areas, ambulances are an expensive luxury. Officials at the Nsawam Government Hospital say the only ambulance they have is unable to serve the needs of the catchment area. Komla Adum reports that the situation is affecting emergency healthcare there.
Increase in road crashes and accidents in parts of the eastern region forced management of Nsawam Government Hospital in December 2018 to create an accident and emergency center to cater for the numbers. Explaining the rationale to JoyNews, Medical Superintendent Dr. Kofi Ablo said the need to stabilize patients who are brought in critically ill was imperative.
We're recording a lot of accident cases, so we decided that no, let's put in this one. The other objective was you have very critically ill patients that come here. You need to stabilize them before maybe if you want to refer, you refer them. That's why you see these monitors and things here. We've also piped oxygen, so we give them, we make sure that we stabilize them before we refer them to outside or we send them to.
While the facility is inundated with these accident cases, ambulances for referrals are unavailable. The hospital has one ambulance donated by a philanthropist. Nsawam Adwadri Municipal Health Director Eunice Ebuako says the situation requires urgent attention.
What we have done is liaise with vehicle owners in the community. We call it community ambulance. That if there is any problem, what should we do? There's this number that we can contact and promptly refer to the next level, that is to the health center, then to the hospital if it's above them. So these systems are there. But for the hospital, I think there is an ambulance here which people use, but they have to pay. So I think it's a private. So recently, our regional director asked of facilities with ambulances, and I know that they are in touch with national to provide ambulances for.
Ghana is to introduce a new malaria vaccine to deal with the increasing cases of the disease-related deaths. Well, it will be the first time in Africa such a vaccine is being introduced, known as RTS. It will be piloted next month in at least 6 regions of Ghana, selected on the basis of their malaria prevalence rates and child mortality pattern, among many other factors. The World Health Organization announced the approval of Ghana's request to participate in the pilot implementation alongside countries like Kenya and Malawi. Patricia Gasu has more.
Ghana has taken delivery of 400,000 doses of the vaccine to be administered in 33 districts in 6 regions. Director General of the Ghana Health Service, Dr. Nsiasari, explains the basics for the selection of the pilot regions.
The technical working group, in collaboration with key stakeholders, including selected representatives from the regional health directories, using multiple and strict criteria, selected now 6 regions. At first it was 3 regions, but now 6 regions, namely Volta region, Oti region, Ahafo region, Bono East and Central region to be the target regions for malaria vaccine implementation program in Ghana. Within these 6 regions, 33 districts have been selected to receive the vaccine, and the rest of the districts in the same regions will be comparative districts. Somebody will ask us, why did you choose these regions and we didn't choose other regions? We are not taking it there to go and kill anybody. We are taking it there because we use a very strict, computerized, and looking at the burden of diseases, the other interventions that we are doing before we chose these 6 regions.
Dr. Nsiasari added the rigorous clinical testing in 7 African countries has shown its potential to boost malaria prevention and save lives. He adds the RTSS is currently the only malaria vaccine to have received positive regulatory assessment.
The vaccine has gone through both international and national screening. so that the vaccine is very safe to be used in this country.
The Ghana Food and Drugs Authority, which gave authorization for the vaccines to be used in the targeted region, says it will continue to monitor to ensure it is indeed safe.
For every new product, we do what we call active monitoring. So we are a lot more vigilant with new products. And so apart from the routine monitoring that will be done, in the districts that are implementing, we've put together an active monitoring program. We developed forms specifically for the vaccine to pick up any adverse events that are known or that came up during the clinical trials. So we'll be monitoring closely. We're working with the EPI program to monitor. We have what we call an expert committee that's already in place. And so any adverse events from the implementation will be brought to that committee, investigated before causality is assessed.
The vaccine will first be administered to infants when they turn 6 months, with another dose given at 7 months, 9 months and 24 months.
Now, still on malaria, each year countries, especially in Africa, spend huge sums of money on mosquito control programs and treatment of victims of mosquito bites. Amidst several interventions meant to eliminate the deadly insect, there are concerns such as such chemical releases will put toxic substances into the environment. There are even suggestions totally getting rid of mosquitoes will create an imbalance in nature. So what is allowing them to live and come into our space but disabling them from biting? How about that? Well, biomedical engineering students of Kwame Nkrumah University of Science and Technology may have answers. They built a robotic mosquito repellent. On Tech Thursday, Love FM's Kwesi Deborah interacts with 3 female students behind this innovation.
Second-year students Joanna Uswapia, Selina Mfiajo, and Daniela Asare called the robot Anquito.
Anti-mosquito, and then we met the Anquito. So as biomedical engineers, we have a mandate to augment life, to make life easier for our patients. So then we sat down to think, okay, there are lots of measures that people are putting in place to prevent malaria and then the action of mosquitoes. But then all these actions sort of kill the mosquitoes. So then what exactly is our problem? Is our problem with the mosquitoes living or the fact that they are in our space? So we felt that, okay, as a community, we realized that there's so much research going into like helping curb mosquito, and then people are coming up with a lot of measures. But then, at what point do people still get the mosquito, get the malaria? Because somebody is in her room, she has a coil, she has a mosquito net, but then she goes outside her house to get fresh air because there's a power cut, and then maybe the mosquito bites her there. She comes inside, sleeps in the mosquito net, but then she has the malaria anyway. There's a high rise of deaths in association with mosquitoes, in as much as people are pumping money into creating a lasting solution. So then we realized that, okay, it's possible that as people go out, they are infected. So then what can we do to help people as they are outside their rooms and then taking in fresh air?
The robot, built with computer programming, emits ultrasonic sounds. Ultrasound is not different from normal sound in its physical properties, except that humans can't hear it. This limit varies from person to person and is approximately 20 kHz in healthy young adults. Ultrasound is used in many different fields, including detecting objects and measuring distance. Its imaging is often used in medicine. Animals, such as bats, use ultrasound for locating prey and obstacles. Anquito emits 38 kHz, which is thought to ward off mosquitoes. Anquito is equipped with sensors which stop and change direction after encountering an obstacle.
And then this is the microcontroller that's controlling the ties. Okay, there are motors underneath. So right now, we don't have a consistent or a lasting power supply. So you realize we have 4 batteries. We have 5 batteries, like 6. And then everything has like run down. So we don't have a lasting power supply. We have these batteries. I have to charge them for long before you could use them for as long as you want. So we would improve on it, like give it a lasting power supply, and then we would want to use it on a larger crowd because it's like a selfish approach.
The students are working to create miniature of the machine and employ artificial intelligence to make it smarter. Reporting for JoyNews, Kwesi Deborah.
Well, and before we go, let's run this by you. It's already topical, and in Parliament, the minority spokesperson on Roads and Transport, Kwame Agboja, is questioning the credibility of the value for money audit government says it has conducted on the $2 billion Sino-Hydro project. He says the Ghana Institution of Surveyors is not the appropriate institution to conduct the audits on government projects, though he admits there isn't any specific legal requirement for value for money audit to be conducted on projects. He says it has been a convention for sole projects.
I saw something attributed to Ghana Institute of Surveyors, though there's not a lead consultant who actually signed and can confirm that he or she did it, because I have serious issues in some, even what has been put on social media, because I would like to know the individual who was the lead consultant who carried out the audit so that I can engage him. But the report I saw on social media only had a telephone number of Ghana Institute of Surveyors, which is unusual, because even in a consultancy firm, there must be somebody who actually endorses things that go out. So that is missing. I think this is a desperate attempt by the government to pretend that something has been done. There are 10 different laws. This is a desperate attempt by government to actually muddy the waters by saying, oh, you have this. Let them publish all of them and tell us who was the lead consultant to carry out this. And the thing is Ghana Institute of Surveyors now the accredited institution of government to do value for money? Because it will be quite instructive.
You should have done it.
Well, there are accredited and known institutions in this country. Normally, we go to crown agents and others. That is what we...
So even if it's been done, you have a problem with the credibility.
Exactly.
It's not the GIS that's supposed to do.
Exactly. And you see, the reason is that, like I said yesterday, there can be somebody who is an architect, but is not qualified to practice because of one reason or the other. Whenever government is doing procurement, sole source procurement, you can go to anybody and say that, oh, Ghana Institute of Surveyors, and then not even identify an individual that can be questioned in terms of that. Then we can take...
One other point that Information Minister makes is that this is not a requirement per any law, that there should be a value for money audit, there should be the Attorney General's opinion. But legally, what they are supposed to do, they've done that.
Well, you see, this is, and I wish you say this to the entire world to hear, that the NPP government that actually saw value for money report on projects that have been brought to Parliament by NDC, today is saying that they have no responsibility to carry out value for money audit on sole source contract. That is a first as well that we must understand.
Well, that's it for the latest news headlines. But look, we have more news. We have the newspapers in the studio. We'll look at what the front page stories are and the back pages as well, and some of other related stories. Already in the Sudan, the news is breaking that military songs have been playing on the Sudanese radio stations for the last couple of hours. But we're waiting for a formal announcement whether there's been a coup d'etat or not by the military. And we have other respective news also for you. Stay with us.